Ladies and gentlemen, I'm your host, the Right Reverend David Clark, and I'm more than happy to be here and happy to welcome you to Highway and Hedges Outreach Drug Recovery Conference. This conference is designed to educate the public and especially the clergy community. Many clergy today are working extremely hard in addressing the opiate crisis. And it is my purpose to inform, educate, equip them with information that they don't have to work much harder in this particular area. I believe that the more education they receive, the better, the more effective they can be in serving the community and especially their church. So I'd like to welcome and encourage you to give your attention to Ashley Potts, a consultant from Highmark, who's making a difference in the community and addressing the opiate crisis. Let's receive her in her own way. Ashley.
Thank you. Thank you for having me here. My name is Ashley Potts. I'm a Senior Project Manager for Strategic Initiatives at Highmark, and I'm here to talk a little bit about what Highmark is doing regarding the opioid epidemic. You know, it's something that we well recognize, and we're doing things to try to assist in that capacity. I think we're all familiar that opioid deaths are far exceeding other deaths, such as motor vehicle accidents and other causes. And in 2017, over 70,000 individuals died of a drug overdose death. Fentanyl is a huge driver in those opioid deaths, and this isn't the kind of fentanyl that you're getting from, you know, your physician or, you know, for pain management. This is synthetic fentanyl coming in typically from China or Mexico, and it's a lot more lethal than the prescription fentanyl, and it is a huge driving factor in the opioid deaths. So some history. You know, currently the epidemic, we're third in the U.S. As far as prescribing goes. In the 90s is really whenever it was marked a rise in prescription opioid deaths. In 2010, that's whenever the heroin deaths kind of kicked off. And as I said, you know, in regards to fentanyl, when 2013, marked the rise in synthetic opioid deaths. And that's really when the synthetic fentanyl started to hit the street. So, you know, how did all of this happen? You know, there was a huge push for some prescription pills, and, you know, starting in the 90s, pain became a vital sign that became attached to reimbursement. There was the perfect storm of events that essentially led to the crisis that we're in. And unfortunately, this crisis has claimed more lives than the Vietnam War. Hepatitis C, as a result of this crisis, is beginning to go on the rise. We know that individuals in the age group 35 to 54 are most likely to die of an overdose death. And that's just something that we're getting from the CDC and kind of looking at those numbers. Pennsylvania is third in the country as far as the overdose rates. However, we are number one with the amount of overdose deaths per state. So, the good news is that just in July, the New York Times released an article that says for the first time since 1990, drug overdose deaths are going down. And here in our local region in Western Pennsylvania, we did see about a 40% reduction in opioid overdose deaths. And that is, by part of community efforts, the distribution of naloxone, things that hospitals and insurance companies and Highmark and everybody is coming together as a community at large to do, and we are reducing the amount of individuals that are dying. There are no statistics, however, I would like to say that point out that it is reducing the amount of people that are using drugs. but it is reducing the amount of individuals that are overdosing and dying to this disease. So what is Highmark doing? What is Highmark's three-pronged approach? The first prong is effective pain management without opioids. And what does that mean? So we are looking at alternative strategies to treat pain that do not require opioid prescription pain pill management. Those can be, they're pain psychiatrists, those can be, massage, acupuncture, different types of modalities to help treat pain before going into that opioid and putting somebody at risk for becoming addicted or dependent on a substance. So we are trying to do that. We here in Pittsburgh have an enhanced pain center that is offering a variety of different treatment modalities to help treat pain before it gets to that opioid level of pain, and really trying to dive into that. Our secondary approach is if somebody does need opioids, maybe those treatment modalities aren't appropriate for that individual, because it is, again, it's a holistic approach. Not one thing is going to fix everybody. So if an individual does need opioids, making sure that those opioids are being prescribed in a safe manner. We are providing doctors with education. Our pharmacy is kind of looking at the prescriptions that are being had. We have centers of pain excellence. We're really looking into all of those different options to, again, if somebody needs to be prescribed those opioids, that those opioids are being done in a safe manner. And then the third approach is if somebody, is an individual who suffers with a substance use disorder, is making sure that they are connected to evidence-based and effective treatment. So are they involved in peer support counseling? Are there more handoffs happening from the emergency department? Making sure outpatient is a covered benefit, buprenorphine, again, medication-assisted treatment for that substance use disorder, and really looking into looking at these evidence-based practices and trying to ensure that individuals are getting the quality of care that they deserve, again, at a holistic level, because it's not going to be one-stop shop that fixes everybody. We do have, a fraud unit that is working in, making sure, looking at those prescriptions, looking at things that are potentially happening, and they do a ton of education in local school districts, working in collaboration with the DEA and AHN, making sure opioid awareness and educational programs are being provided. And they do now have a pharmacy lock-in program that if somebody might be, getting more prescriptions than they're supposed to, or seeing more physicians than they're supposed to, they are able to alert that and then identify them in this program. And they do have some numbers that shows that once they're identified, they are able to reach out to those individuals and get them connected into treatment. So again, we're looking at everything we can, every option that we can, to be able to try to have that intervention with somebody and hopefully save their life. We are doing a lot of community engagement, again, making sure that we're out there, we're providing that education, we're being a part of our community, because we know that, Highmark's not going to solve the opioid epidemic. We need to partner with our community stakeholders and really look at each community and how we can help serve that community and what we can do about it. The good news is, we are seeing some good numbers ever since that we started implementing some of these programs. In 2016, Highmark's rate of overdose from opioids within its membership was 50 to 100,000 members, exceeding the national average. But by deploying our three-prong approach, the rate of overdose from opioids now declined by 70%. And it is now below the national benchmark. So I would say that what we are doing is we're able to look at those numbers and those trends over time, and we are having a positive impact on individuals who are struggling. We are reducing those overdose deaths. Another thing that we are doing is we work very closely with our partners at Allegheny Health Network, and they have an addiction medicine service. So if somebody has, an intercept with one of those hospital systems, they are able to get connected to social workers, nurses, and physicians who specialize in just addiction medicine, making that connection, getting them connected to the appropriate treatment modality. And if they're admitted to the hospital because of oftentimes a catastrophic medical event following injection drug use, that team is there to coordinate their care and making sure that they're getting the appropriate needs met. And again, we work very closely with AHN's Addiction Medicine, with the Enhanced Pain Center, and we're really doing everything we can, from a community and a holistic perspective to make sure everybody has individualized quality of care, and really meet them where they are to get them from point A to point B. Is that okay? Is that enough?
I appreciate your coming and you sharing with passion regarding this particular crisis. I'm interested in finding out how effective your program is with, how effective it is with disenfranchised community. Finance is a issue. They just can't afford to get treatment. Do you have any wraparound financial agencies who can assist in this particular area?
So one of our our partners, AHN, that we work very closely with, actually have what's called a street medicine program, and they will go out and they see individuals who are unstably housed, maybe at the local camps, and they do try to reach them to get them connected into the appropriate treatment modalities. As far as drug and alcohol treatment goes, every county in the state of Pennsylvania has access to what's called a single county authority, and they are the sole distributor of federal and state dollars for individuals who do not have insurance and access to that care, and they will fund their treatment services for them. And social workers and individuals working in the addiction community, they do know that. They're very well versed in, if you have Highmark, you go this way. If you don't have insurance, you go this way. If you have Medicaid, you go this way. So insurance is not a barrier to somebody getting access to treatment.
I'm sorry, I just really missed most of it, but for the most part, the end part was really wonderful. So if I could just get a better understanding, you guys are offering programs to the community that help people that are addicted to drugs and alcohol, opioids?
Yes, so AHN has a lot of those direct clinical services, the addiction medicine team and the street outreach. At Highmark, we do offer case management for all of our individuals. They can call in, we can provide those supportive services, and then they can get connected, via that way they get, our case managers have the ability to, if somebody doesn't have a PCP or a psychiatrist appointment, they have the ability to get those appointments very quickly. So it's a really good utilization of their services.
So it's just not for drug and alcohol, it's for anybody who basically needs services, women who are sex trafficked and going through hardship and things like that.
I would say that if you called the case management team, no matter what your problem was, they'd figure out how to solve it and get you connected to the appropriate treatment, whether it's trauma therapy for somebody who is sex trafficked or, anything like that. They're very well versed in behavioral health services.
Wonderful.
Well, recently the media indicate that minority women are underserved population. Do you have the same type of program you offer provide for them?
So I would say all of our programs are not discriminatory. We see anybody, despite, whether it's over at AHN or if you're Highmark and you have Highmark insurance, no matter what walk of life you come from. There are, again, AHN has a specialty program for immigrant and refugees, and they can access that program. So there is a plethora of information within the Center for Inclusion Health over in the north side that they really offer. Their main mission is to provide services to oppressed and vulnerable populations.
Okay. That's fantastic because we are reaching out to the Latino community, the Asian community, and being able to provide programs that address people who are going through traumatic experiences. So we're looking in the future to
Is your company organization only for Pennsylvania?
No, so Highmark, AHN I was talking about specifically because they're kind of in western Pennsylvania.
Uh-huh.
But Highmark itself is Pennsylvania, West Virginia, and Delaware.
Oh, okay. Well, I was just gonna say that this needs to be everywhere because like, it's across the map. So that's good that you guys are on the frontier, the forefront of doing that and starting it, so.
Where are you from?
I'm from Ohio, but I mean, I've seen, people with a lot of different circumstances and addictions in every state. I've lived in Oklahoma, Texas, Florida, California. So I just mean, it's just everywhere.
Absolutely. Everywhere in each community needs to be treated
Everywhere,
individualized and
exactly.
understanding the needs of that community. And so that's really, we have a lot of experience in that area. So that's really why we're trying to take a community approach.
Well, I don't have any further questions.
Okay. Thank you so much for having us.